Most respected His Excellency Shri APJ Abul Kalam, former Prime President of India, Shri Ghulam Nabi Azad Ji, Honorable Minister for Health and Family Welfare, my good friend and the moving force behind the HIV Forum of Parliamentarians, Shri Oscar Fernandez Ji, Shri J.D. Seelam Ji, Mrs. Margaret McGlynn, senior officers of the Government of India, distinguished participants, ladies and gentlemen. It's indeed a matter of great pleasure for me to be here this evening to welcome you all to this extremely important event, the Symposium on Accelerating India's Response to Research for a Preventive HIV Vaccine. We all know the importance of the cause that we are here to espouse. We all know the enormity of the challenge. I'm not going to detain you much longer in repeating what I believe and what all of us in this hall believe to be the single most important challenge of the 21st century, and that is finding ways and means and vaccines and technological interventions to eliminate this scourge from the face of the earth. And I must say that if there's one single most important challenge that the entire human race faces in common in this century and in the years ahead, it will be HIV/AIDS. It has been proved to be the biggest taker of human lives. Indeed, it threatens the very social fabric of the world in which we live. With these preliminary remarks, I would like once again to welcome all of you, and I now proceed to state a few facts for your consideration. We have been told that despite some advancements in our endeavors to fight this scourge, there is still a huge challenge that confronts us, that stares us in the face. Some of the statistics are self-speaking. I am told that even if the number of new HIV infections continue to decline at current rates, there will still be an estimated more than 22 million new infections emerging by 2015, until and unless we are able to find something drastically important which could eliminate the virus. Fewer than 1 in 5 people at greatest risk of infection have access to effective prevention programs such as education, condom distribution, prevention of mother-to-child HIV transmission, and HIV testing. We believe that the new HIV infections could be significantly reduced if effective prevention programs are expanded and reach those at the greatest risk of the infection. The global momentum behind the call to find a cure for AIDS epidemic has reinforced the case for the use of a combination of preventive strategies. The past 10 years of HIV prevention activities are beginning to show results. Despite the enormity of the challenge we still face, the number of new cases of HIV/AIDS annually have shown a substantial decline from about 270,000 cases earlier to about 120,000 cases. And at this point of time, may I pause to pay my fulsome tribute to the extraordinary effort which has gone into the cause led by my good friend Oscar Fernandez Ji and his team of parliamentarians in spreading more information and educating more people about the enormity of the challenge and the need to take it on a mission mode, not only nationally but globally. If scaled with resources and a sense of urgency, a preventive strategy supported by other key interventions can save lives, prevent new infections, and lower the cost to fund the global fight against AIDS. Significant recent research breakthroughs in the area of HIV prevention, particularly in terms of ARV-based prevention methods such as pre-exposure, prophylaxis, and provision of early treatment to prevent HIV transmission, are important contributions in the ongoing research. We must find ways for developing vaccines that help us overcome the difficulties posed by nature. Insights and lessons from recent advances in the field of HIV vaccine, R&D, particularly the findings of the RV144 and the discovery of the broadly neutralizing antibodies, give us hope and a sense of optimism. Given the complexity of the task, the best minds must work together in furtherance of the objective of collaborative science. One of the most important features of the 21st century science is that it has ceased to be competitive, it has indeed become collaborative. And that is primarily in response to the reality of the situation, namely that most of the challenges in the medical field that the nations and the world indeed faces are challenges in common. Therefore, we need collaborative science rather than competitive science. We are delighted to learn that some of the leaders in research are participating in the Science Symposium being organized as a part of this meeting. I am sure that this meeting will instill great hope in the people of India and indeed worldwide who are looking towards science for evidence-based prevention interventions for HIV, such as the requisite vaccine. It is noteworthy, ladies and gentlemen, that all research agencies, be it in the Ministry of Science and Technology or in the Ministry of Health and Family Welfare, are indeed working together and have established close and effective collaborative efforts for accelerating our research work. And this national effort is closely networked with leading AIDS research institutes in the world. The Union Ministry of Science and Technology, which I have the privilege of presiding over as the Minister of State, is encouraging our best scientists and technologists to engage in finding solutions to major public health challenges such as AIDS, TB, and malaria, etc. We have also floated many novel mechanisms by which academia, industry, and public health experts can work together to develop effective preventive and therapeutic technologies. We are establishing a large number of centers of excellence where science, medicine, and engineering can be linked to design novel solutions and technological developments. A fine example is the HIV vaccine design program, which has been established by our Department of Biotechnology, and I would like to pay fulsome tribute and compliment our Secretary, Department of Biotechnology, Mr. Bhan, who is in the audience, for outstanding work in this area. The collaborative partnership between Translational Health Science and Technology Institute and the International AIDS Vaccine Initiative is indeed an initiative of global proportion and worthy of global recognition. The research work will aim to understand the biological processes connected to the HIV infection to design a novel vaccine. The focus will be on the subtype C of HIV found in India predominantly. In conclusion, ladies and gentlemen, let me take the opportunity to once again express our immense pleasure in hosting this conference and in welcoming you to this event of seminal importance. May I congratulate the local organizing committee, distinguished guests, and representatives from various backgrounds who are participating in the deliberations. I wish the conference well as it progresses over these 2 days. I am sure the novel presentations and debates will indicate new ways and break new pathways for enhancing the work in the field of HIV research. I am delighted that professionals, political leaders, scientists, and many other stakeholders are engaging with each other through conferences like these. I wish you all success. Thank you very much.